My name is Dr. Ijeoma Isiadinso. Familial hypercholesterolemia is diagnosed one of two ways. It is usually based on cholesterol levels, the LDL, the bad cholesterol, and a family history of early onset heart disease and stroke. There are some clinical findings that are associated with familial hypercholesterolemia, but they occur in a different variation for individuals. And so you don't want to rely just on the presence of these clinical findings. It really is the level of the cholesterol and the personal or family history of strokes or heart attacks. There are two types of familial hypercholesterolemia, also known as FH. The more common form is heterozygous FH. That occurs in about 1 in 250 individuals and is a result of a genetic mutation that occurs in one gene inherited from a parent. Homozygous FH is the more rare form, and that occurs because of a mutation that occurs in 2 copies of the genes which are inherited from each parent. That is a more severe form as well. So individuals who have homozygous FH will have LDL levels 400 and higher. Whereas in heterozygous FH, the LDL levels can be 190 and higher. There's also a difference in when these individuals have heart attacks and strokes. And so the homozygous patients were more likely to have heart attacks and stroke at a younger age, as early as their 20s and 30s. Whereas heterozygous patients will have a heart attack or stroke much later in life, 40 to 50. So prematurely compared to the general population, but later than those who have homozygous FH. The important thing, and actually difference between familial hypercholesterolemia and what one might consider regular high cholesterol, or more importantly, non-genetic type of high cholesterol, is that diet and lifestyle alone are not sufficient to treat familial hypercholesterolemia. These individuals are going to require medications. Some may require multiple medications in order to get the LDL levels low enough to reduce their risk of developing a heart attack or stroke. The other things one can do to reduce their risk of having a heart attack or stroke if you have FH, or making sure that all your other risk factors for cardiovascular disease are well controlled. And that means making sure your blood pressure is well controlled. If you're a diabetic or have high blood sugar, that's under treatment. If you're obese or physically inactive, that you maintain a healthy weight and you're exercising. And most importantly, that if you're a smoker, that you quit smoking as well. The first thing I would say is, once you're diagnosed, is to educate yourself as much as possible. There are a lot of resources online where you can get information about familial hypercholesterolemia, and working with your doctor to make sure you have a good understanding about what the disease is and what it takes to treat it and what your risk of having heart disease and a stroke is. So if you think that you or someone in the family has FH, the most important thing is to make sure that you're under the care of a specialist who understands and has experience treating FH. So that would be a lipidologist or a cardiologist, preferably a preventative cardiologist. The other thing is to make sure that you also share this information with your family. Because it's a genetic condition, it is important that we tell our family members so they also can get tested, and they would then be able to have an opportunity to be treated early and possibly even prevent themselves from having a heart attack or stroke.